My goal weight is 135 pounds.
Between the hype on social media and the relentless TV ads, questions are swirling around this type 2 diabetes medication.
And you may lose weight.
So how well does it work for weight loss, and who should be taking it?
This is an important medication for us because it changed the entire playing field. I really like this idea.
Dr. Sean Wharton specializes in diabetes and weight management. He emphasizes obesity is a complex medical problem, not a moral failing. Aside from bariatric surgery, there's been no highly effective treatment. Wharton studied Ozempic for the drug maker. Studies funded mostly by Novo Nordisk found, in combination with a low-calorie diet and exercise, 86% of people on the drug lost between 5 and 15% of their body weight after a year.
Over the past 5 years only, we've had this new field of medication that really works. Patients are finally getting some relief from this medical condition that has plagued them for a long time.
It is gratifying to see widespread knowledge now surrounding these medicines. Of course, that comes with a concern.
In scientific circles, Dr. Daniel Drucker is a big deal. His work laid the foundation for this new field of diabetes and weight loss medications using the drug semaglutide.
It works through receptors on cells.
Semaglutide tricks the brain. It mimics a hormone that regulates hunger and food intake. It slows down the emptying of the stomach so people feel fuller longer, potentially leading to weight loss. But studies also showed side effects, including stomach pain, vomiting, and fatigue. The drug also increases the risk of suicidal behavior and thyroid cancer.
These are medicines. They're not harmless candies that people take, and medicines can have side effects and need to be used appropriately.
Doctors also note the weight only stays off as long as you keep taking the drug.
I can understand why people want to believe that there's a quick and easy solution, but it's not there.
Dr. Nav Prasad says fad diets also offer quick weight loss that doesn't last, and he warns diet drugs have come and gone.
We've seen it happen many times where there were these heralded wonder drugs that turned out not to work or to harm or kill people.
In France, a diet drug that started as a type 2 diabetes treatment is now being blamed for thousands of deaths due to heart valve problems. Other drugs have had similar problems. Some, including endocannabinoids, have led to psychiatric side effects, including suicides.
I got to the point where I was about 360 pounds. I was hypertensive, had severe sleep apnea.
Ian Patton works for Obesity Canada, which receives money from Novo Nordisk. He's been taking Ozempic for 2 years and has lost about 50 pounds. Patton says for him, the benefits of easing other obesity-related problems outweighs the risk from the drug. But
it's not something that someone should be taking to lose that 10 pounds before they go, for their wedding or their beach vacation. This is for people who are sick.
So, Christine, I'm going to presume that this is an injectable drug?
That's right. So Ian, whom we just heard from, injects himself with it once a week, and it costs about $250 a month. But keep in mind, as we mentioned, if you want to keep that weight off, you have to take this drug for the rest of your life. So it becomes a larger expense. And also, there's no studies that have been done for anyone taking this drug for the rest of their life and the effect on their overall health.
So what do people need to watch for next in terms of, making an actual informed decision about this?
Well, I think it really is the research. A lot of the research has been done on people with diabetes, and the overall safety profile for them is good. We haven't seen what it does in people with obesity for very long. There is a study that's being done. It's set to come out this summer, the results of it, and people are hopeful. The dosage is different. People with diabetes get a lower dose than people with obesity. And I should emphasize, though, there are studies happening for people with obesity. Doctors say there are no studies for people who are just taking this drug to lose a few pounds, to go to an event, and for them, the risks far outweigh the benefits.
Okay, this is always good to know. Christine, thank you.
You're welcome.